Hello, this is Dr. Gay from First Look MRI, and this is an 87-year-old female with complaints of left hip pain and stiffness. She had an x-ray here that showed arthritis of the left hip joint. This is the round femoral head, but it's not quite as round as it should be. We see this bone that's flattened here laterally. There's a bony spur, looks like a bird's beak here. The joint's a little bit narrowed, but there's no bone destruction, anything else going on. This is a view where we're looking straight at the left hip. Another view here looking straight at the left hip. On this view, fat is bright. We see the subcutaneous fat bright. Marrow is very bright, filled with fat. And we can see that bony spur pretty good over here now on the outside. And if we go towards the back, we see this erosion. Underneath the femoral head, we see these areas of darkness. These are bone erosions, little bites out of it, looks like. And on this view, we see the marrow edema, or brightness of the bone, irritation of the bone. So on this view, fat is bright and we lose the fat, so we know we're losing the fatty marrow related to these bone erosions. And in this view, fat is dark and this is bright, so we know that the fat again is infiltrated and some edema is in the bone here. So mild erosive changes of the femur, but the main finding is out here to the left, or the lateral side of the joint. So the joint is here, maybe a little bit of brightness along the inner side, but there's a glob of intermediate signal right over here on the outside of the joint. We see it over here on this view as intermediate to low on the T1 weighted view, this glob of darkness here. And this one, it's slightly brighter than muscle. Here's a gluteus muscles over here, intermediate, so a little brighter, and here we go, a little bit darker. So fluid is white. This is fluid in the bladder. Typically when we see something outside of the joint right here, 9 out of 10 times it is going to be a paralabral cyst. The labrum is over here and the labrum can tear and fluid can build up out here and it can look very similar to this, but rather than being so intermediate signal, it's usually light bulb bright like this. So we know this is not the typical paralabral cyst we see in this region. It's something else. And so anything juxta-articular like this, we think about synovial inflammatory processes, because they can be associated with the joint, and this is what we believe this to be. So this is probably gouty arthritis, and so gout likes juxta-articular locations and it can cause bone erosion. So now we're going to look carefully for erosion or other processes. So this is the outside of the joint. Also down here, this is a gluteus muscle, up here, gluteus intermedius muscle, and there's a tendon coming down. And right here, there's a little foggy brightness. This looks like a similar process over the greater trochanter over here. So it looks like if this is gout, it's involved in the joint and also where the tendon attaches here to the greater trochanter. And gout can also do that at the tendon attachments. So we're going to look at one more thing here. We're going to look for bone erosion. So if we go forward here, don't say anything. If we go towards the back, there it is. So we see a little bite out of the ilium. This is the ilium coming down. The black line is the cortex, and right here a little bite out of it. So again, the gout will like to erode the bone right where it attaches, or the ligaments, or the iliofemoral ligament, which comes up here, attaches to the bone here. So this is further evidence for gout. We can see on another view here, an axial view, some subtle findings of bone erosion. Here it is right here. So this is the process over the lateral hip. This is the acetabulum, and you can see that scalloping of the bone. Normally the bone would be more smooth and rounded. Instead there's a little subtle cortical scalloping, and this process has eroded the bone. So it looks like chronic erosion, typical for gouty arthritis, and hopefully we'll get some follow-up on that one. Thank you very much.